Whether you are joining us today live on Facebook or you found us on YouTube, I'd like to welcome our audience. This is our third video in our series we're calling Wrangling Parenthood, presented by Chisholm Trail Pediatrics. I am your host, Shane Littleton, the CEO of Chisholm Trail Pediatrics, and I'm joined today by our expert, Dr. Andrew Cavanagh, who is going to be talking to us about wrangling ADHD. Today we are going to be talking about ADHD in pediatric patients. We will be discussing questions like what is it, what causes it, and what to do about it. We will be taking questions and comments from the live Facebook viewers that will be addressed towards the end. Dr. Cavanagh, let's go ahead and get going. Why don't you start off by first explaining to our audience why we're able to sit so close together without wearing masks, which is kind of weird these days.
Yeah, this is not an optical illusion. This is actually not 6 feet. Both of us being in the 1A tier for the COVID vaccine, as healthcare workers, we've been both vaccinated twice. So we're now at the 95% effective rate, which is as high as it's going to get. You might notice that out in public, people are still wearing masks even after being vaccinated. That's not just part of being in a social contract. That's very difficult to, tattoo on your head saying that you've had the vaccine. It also, there are some studies that might indicate that if you've had the vaccine and you're exposed to COVID, you might shed some viral particles. We don't know that for sure yet, but until that's studied more and until more people in the community are vaccinated, we're still going to need to wear our mask when we're around each other in public. However, both of us being vaccinated, we're not going to share it with each other, and it's not going to be a problem because we've been vaccinated.
Very cool. Yeah, we're all really excited about that. I know one of the goals at Chisholm Trail Pediatrics is to get every single person vaccinated, so when people come and see us, they can do so without worry.
Right. Every person in our staff.
Yep. All right, getting back to the topic at hand. First, Dr. Cavanagh, do you care to share your experience with ADHD and why you consider yourself somewhat as an expert in this subject?
Well, it's a specific area of interest of mine for actually take care of ADD. Not all of them feel comfortable taking care of ADD, and there's a huge need in the community, and it's something that I feel is extremely important, and as such, it's been something that I've studied more, I've taken more personal time to read about, and there's also a personal experience in my own household. I have a son who has ADD. In fact, I have 2 sons with ADD, and many people who have met me might claim that I also have ADD.
Including your own personal doctor, right? All right. Well, let's start off with one obvious question. We've heard ADD and ADHD. What is the difference there?
Well, the nomenclature is very confusing. Nowadays, we just use ADHD. That was set in place in 1994, that it's all under the umbrella of attention deficit hyperactivity disorder. However, you'll still hear professionals and other people interchangeably use ADD and ADHD. Quite honestly, I think it's splitting hairs to try to definitively say one or the other. So when we use ADD, we also mean ADHD. They're really pretty much interchangeable at this point. So, at risk of oversimplifying what ADHD is, it's a chronic medical condition that's characterized by difficulty maintaining focus. Now, some people also have difficulty with hyperactivity and fidgetiness and impulse control. Generally, I would say there's 2 subtypes or flavors. You get your daydreamers and your wall climbers. Okay,
so in this case, ADD patients would be the daydreamers, and the ADHD patients would be the wall climbers.
Right. The inattentive subtype, the just strictly attention deficit patients would be your daydreamers, and then those who have the hyperactivity component as well would be your wall climbers. And if you have those in your house, you certainly know that for sure.
You know which one's which, right?
Oh, yeah.
So what causes ADD or ADHD? Is there a cause?
Bad parenting.
Right.
ADD has a strong genetic component. It runs in families. That said, we've done there's lots of studies done on and imaging, both on the structure and the function of the brain, have shown that there's a chemical issue implicated in the brain chemicals that signal to other parts of the brain in the frontal subcortical part of the brain. So this kind of supports why a chemical or medical approach seems to be the most effective treatment for attention deficit hyperactivity disorder.
All right, excellent.
So it's with neurotransmitters again, and neurotransmitters are chemical signals.
All right, so you said it's genetic, and if you are a parent and you have ADHD, should you already have that kind of on the radar to look out for your child?
That's a great question. Well, having ADHD certainly increases the risk of having that your children would have ADHD. It doesn't mean that they definitively will have it. For instance, in my household, my daughter is much like my wife. She's well focused. She's able to get through things very well. And unfortunately, my son.
Right. So, how do you make this diagnosis? What is the medical process that goes through your head when you're diagnosing this condition?
Well, most often concerns from the teachers and performance in school often will set the ball in motion. Many times, though, parents already have some suspicion that maybe their kids might have difficulty focusing. Nonetheless, either way, the first step would be to bring your child to their pediatrician for evaluation. At that point, your pediatrician would get a good history and physical exam to help rule out any other causes like thyroid disease or sleep apnea. Like many mental health conditions, however, unfortunately, there's not an objective set of tests or imaging that we can get to help make the diagnosis. There's no blood test we can say, oh, look, here's your blood test, you have ADD, or, oh, look at this on your x-ray, you got ADD. So you're left then with two kind of different approaches. One approach, the more thorough, more rigorous approach, is neuropsyc testing. And that involves hours of testing, can be quite expensive, and can be challenging at times to find an expert who's capable of administering and evaluating that test. As such, the AAP had to come up with what is a more practical solution in diagnosing this condition. And so that approach is through some questionnaires, both that a parent and a teacher would fill out. Once those are filled out, the parents would come back and the pediatrician will evaluate the symptoms are consistent with their criteria for ADHD, but also to see if there are other things like anxiety at play. So when these are completed, the pediatrician would have a thorough consultation appointment with the parents to discuss the results.
So that's interesting. There are actually forms that are filled out by both the teacher and the parent, so you can objectively see what's going on at home and at school, so that teacher can compare your child to other kids his or her same age.
Which is really helpful because the teacher is a great resource that way. Obviously, any 8-year-old boy is going to be full of energy and easily distracted to some degree. But a teacher is able to compare them to other 8-year-old boys, and that's a really helpful tool for the parents and the pediatrician to use in the evaluation. Furthermore, having it in two different environments is really part of the criteria for diagnosing ADD. If your child only has symptoms in one environment, then it raises a concern that maybe it's not actually attention deficit hyperactivity disorder, but maybe something with the environment.
Interesting, okay. And how young can you make this diagnosis?
Well, while many parents will tell you they've seen it all along, the symptoms all along in their children, the younger a patient is, the more difficult it is to make an accurate diagnosis. That said, usually 5 or 6 years of age is the youngest that we'll see to evaluate a patient.
Okay. Also, one thing we're seeing right now a lot of in this COVID environment is pediatric anxiety, right? What is the difference, or how would you distinguish between anxiety and ADD?
Well, that's a really important question because anxiety and depression can actually impair our ability to focus. And so frequently you'll see patients with those conditions have difficulty focusing as part of what they have. With anxiety, as opposed to ADHD, however, there often is an emotional component. So often a person with anxiety, they'll feel self-conscious, they're easily embarrassed, and they're afraid to do things, often afraid to try new things. And this is in stark contrast to patients with attention deficit hyperactivity disorder, or ADD, that they have impulse control. And so they try things before even thinking at all about it, and that can cause problems in itself. So that said, it is actually possible to suffer from both. So it's very important that there's a thorough evaluation and follow-up with your pediatrician.
Okay. So after the first consult, when they come in to see you, I know you usually recommend them do some routine follow-ups with you. What is the purpose of these med checks, and how often do you suggest they come in?
Well, ADHD medicine is not unique. any chronic medication really requires follow-ups from a physician. And that's true with any type of medicine and any branch of medicine. And so specifically for the medications that we typically treat patients with ADD, we need to monitor their growth. We need to monitor blood pressure and heart rate. But most importantly, we need to see how the patient's feeling on the medicine. These visits, these medication follow-ups, present an important opportunity for the student, the patient, the child, the student, to share how they're feeling, to be able to speak up on their own behalf. Usually the first follow-up on these is a month to 3 months after beginning medication, and then any follow-up afterwards ranges from 3 to 6 months.
Okay. And how do you treat ADD?
Well, with most conditions, whether it's asthma or reflux or allergies, really the more angles you can take, the better. So we like to take. So among the non-medical things that are really critical in treating ADD, sleep is among one of the most important. If you're not getting enough sleep, regardless of whether you have attention deficit or not getting enough sleep is a very common cause for easy distractibility and difficulty concentrating. So sleep is critical, making sure that we're both getting the quality and the quantity of sleep that we need. Furthermore, eating well, specifically eating food sources that are good slow burn fuel. Because if you eat foods that's real sharp up and down in your blood sugars, it's a little bit more distractibility. That said, healthy eating habits, eating foods that are, making sure we're getting your 5 fruits and vegetables every day, guys, and making sure that we're eating slow-burning carbohydrates, proteins, fats. And then exercise. Exercise is paramount. Exercise is paramount for really any medical condition, especially for attention deficit disorder. So at school, accommodations. So when somebody is diagnosed with attention deficit disorder, we recommend certain accommodations, things that can help, maybe putting the student in a less distracted part of the classroom, those kind of things. And then on the parent end, coaching from the parent and for the parent on how to raise a child with ADD and how to teach the child how to handle their ADD. As far as non-medical but supplements, we've extensively studied lots of different things, and unfortunately not a lot has been shown to be very effective, but one has shown some modest benefit if used on a long-term basis, months, and that's EPA, which is eicosapentaenoic acid, which is a mouthful to say, so I just say EPA. And this is an essential fatty acid found in fish oil, but you can also get it in pill form, and it can be a good additional help providing modest benefit for patients with ADD. Obviously, last but certainly not least, medication. I would love to say that everything else is the most effective, but studies show that stimulant medication is still the tried and true most effective treatment for attention deficit disorder. That doesn't mean that we can't try everything else first. It doesn't mean that a parent has to try that, but I will say that it is safely and effectively treated attention deficit disorder for decades now.
Right, and what would you say to a parent that was nervous about the side effects of some of these stimulant medications that you're recommending for their child with ADHD?
So I would say it's wise that they're concerned about side effects. Any medicine has side effects, and that's a good question for any medication that you're on or your child is on. So I would say that it's an important discussion to have at that consultation visit with your pediatrician on what are the benefits, what are the risks, what are the side effects of this medication, and then coming up with a decision with your pediatrician at that time on if and what type of medication your child will be on.
I know one question that we routinely get from parents is medicine a crutch? Shouldn't they learn to deal with this ADD on their own without stimulant medication?
I hear it all the time, Shane, and I understand where that's coming from. Certainly, absolutely we want to make sure that we coach our children on how to handle conditions they have, whether it's attention deficit or asthma or anything else. But treating ADHD with medication is not a crutch, much like a patient with asthma. If they're taking asthma medication so that they can breathe, that just allows them to even the playing field so they can exercise and run and play like other kids. It doesn't give them enhanced abilities at sports. It doesn't give them an easy way out. It just helps them not to wheeze and help them to breathe. In the same way, treating ADHD just evens the playing field for them, right? They still have to do the homework. They still have to study. As disappointing medicine doesn't do their homework for them. They still got the same amount of homework. So I agree that it's important to coach patients and students on how to handle their condition. It's not mutually exclusive with other forms of treatment.
And what about the non-medical treatments like alternative medicine? What's your opinion on that?
So, unfortunately, there hasn't been much found in the way of non-medical treatments that have shown much promise. Outside of what we discussed, right? Healthy diet, exercise, coaching, those things can be effective. And counseling, those things can be effective. So we don't always need to treat with medicine. However, as far as non-prescribed medicine approaches, kind of the alternative medicine approaches, unfortunately, none of those have shown much promise as of yet. So dietary approaches like eliminating sugar and dyes in the food haven't shown in studies to have much benefit clinically, or really any studied benefit at all, unfortunately. Adding zinc and magnesium, very similar, very modest to no benefit whatsoever in the studies. That said, those are fairly safe approaches to try. So if I have a family that wants to try to do those things, I certainly won't stop them from doing that. But these approaches have not shown much benefit, so I don't have much confidence in their ability to change the course of a patient's ADD. As for other alternative approaches, there are myriads. We could sit here for hours and talk all the different approaches that are advertised as things that are able to treat ADD. What I would say, rather than say specifics on anything, I would like to recommend some general guidelines on how to think these things through. So when deciding if you want to try these treatments, it's important that you ask yourself some questions. Were independent clinical trials performed that prove that it works? If the only proof that a medicine or treatment plan has is testimonials, that is a flag. Can you find information about this treatment from a respected source? Not just a small article, not just a small obscure journal, but a really respected source. Is there a respected national organization of people who practice this type of treatment, and do they require a state license? And then lastly, and certainly not as important as the other ones, but does health insurance cover it? Health insurance typically does not cover unproven treatments. That said, sometimes health insurance doesn't cover proven treatments, so I'm not going to go all in on the health insurance, but it does raise concern. So I'd like to remind people to keep in mind that natural is not always the same as safe. For example, opium and cocaine, those are natural. I would not necessarily call them safe.
Not so safe.
But there are plenty of alternative things that are natural and safe, but that doesn't mean always the same thing. So we want to be careful with that. I would be wary of any claims of a treatment that says it works for every single person, or if a medicine is overselling itself, saying it's a wonder drug, it's a secret cure. Those are things that would raise my concern. But the bottom line is, on any of these things, it's important to bring them up with your pediatrician. If you have a question, certainly bring it up with us, because we welcome discussing different types of approaches for treating ADD. We are not pill pushers here. No pediatrician is a pill pusher. We are trying to treat the patient as best as possible, but with a parental input as well. So we come up with a plan, and we'll be as honest and forthcoming as possible on the overall treatment plan.
Great. That's a lot of good information. What are some good resources for parents that have kids with ADD that they can go reach out to on their own?
So when I talk to parents about ADD, I like to give them numerous types of resources. So as far as websites go, I like CHADD, that's CHADD.org. That is the website for the children and adults with ADHD. A fantastic foundation. It's been around since the 80s. It is a really good website. I also recommend childmind.org. Both of these are really good resources. As far as books, I like Super Parenting for ADD by Edward Hallowell. He is a Harvard physician, pediatrician who specializes in treating ADHD only with ADHD. So it's his passion and his expertise for sure. I also like another expert on the subject is Russell Barkley. He's got a book, Taking Charge of ADHD. I think those are both good books. As far as podcasts go, there's the Distracted podcast. That's also by Dr. Edward Hallowell. And then for parent training classes, because as mentioned before, coaching is always helpful. There's a couple different resources in the city. The Austin Child Guidance Center has classes at times, and so you can find out if they have any going on at austinchildguidance.org. And then ABA Connect, Connect ABA has that. And so abaconnect.com also has parenting classes.
Great. And we're going to see if we can have our producer put those resources in the details of the video today so you can also check those out on your own. A few more questions. When parents call in to get a refill for the medication, or they need to get a refill every month, can they just call the pharmacy, or do you suggest calling us?
They can call the pharmacy. It is much more efficient if they call us directly, though. They'll get their prescription filled faster if they call us for those refills. And that's strictly just for the controlled substances.
Right. For the non-controlled substances, you can still call the pharmacy first, and they'll send us the request.
Absolutely.
What are some signs to indicate that you may need to have your child evaluated? What are those red flags?
So not appearing not to listen, being forgetful, losing things, poor organizational skills. Those are all things that are consistent with inattentive problems, right? The daydreamer issues. Being running on a motor, like looks like it appears that someone is running on a motor, or climbing on walls, literally,
right.
Or not. Things that are concerning, or fidgeting frequently. Those are things that are consistent with hyperactivity. As far as impulsivity goes, blurting out answers, interrupting frequently, going on and on and on and on. Those are concerns for impulsivity. So those are some of the symptoms that could be warning signs or indicators that may have ADD.
Great. And we actually have a question from one of our viewers. How do you treat sleeping issues with kids with ADHD, specifically kids that frequently at night?
This is a question I get frequently. Problem sleeping or insomnia is often a comorbidity with attention deficits. Comorbidity means something that it runs with it. They're not necessarily the cause of one another, but they seem to be found together, like peanut butter and jelly. The peanut butter doesn't cause the jelly, but you see jelly a lot of times when you see peanut butter. More so with ADD, you'll see insomnia. In the past, with older formulations of stimulant medicines, actually those medicines even worsened sleep problems. So I want to bring that up because nowadays those medicines are better tailored, that they should be out of the system and not affect sleep whatsoever. That said, children still also have difficulty sleeping when they have ADD just by nature. So there's certain things. Sleep hygiene is the most important. And so we can certainly, I was planning we could have a podcast at some point going further into sleep issues because there's a lot to talk about. But good sleep hygiene involves having a very set routine, unplugging it at least an hour before bed, making sure that we don't have any devices in our room, even during the day, that the only thing we ever do in our bed is sleeping. So we're not reading a book, we're not drawing, we're not on TV or video games in bed, that bed is strictly a place for sleep. And then we have some wind-down activities during that time. If those don't work, and it may take weeks and weeks to really establish a very set routine to get the body understanding and regulated on sleep issues. If those things don't work, sometimes we need to encourage with a natural, healthy supplement like melatonin.
Right. I know we definitely use melatonin for our kids. Only way to get them to go to sleep. Well, that's really good information. Our producer has put the resources that we mentioned before in the comment section, so please check that out. That's actually to thank Dr. Andrew Cavanagh and Chisholm Trail Pediatrics for helping set up this video. If you enjoyed today's conversation, please make sure to hit that like button or give us a thumbs up on YouTube. If you have any questions that were not answered, please feel free to leave them in the comment section. Or if you would like to suggest topics for future videos, you can write them in there as well. If you would like to set up an appointment with one of our providers at Chisholm Trail Pediatrics, please call either of our 2 locations. Or if you'd like to support Dr. Cavanagh and Chisholm Trail Pediatrics, the best way to do that is to leave a 5-star review on Facebook or Google using a link that will be available below. I encourage everyone to go check out other videos in the series and tune in next time for another. Feel free to hit that bell button on YouTube to get updates about our latest videos. Thanks for joining us, and until next time, wash your hands, wear your masks, and stay safe.